I'm on vacation. I'm camping at the coast, and I was supposed to have my first therapy session this week where I was going to learn the exercises, but that didn't happen because my therapist was sick. I was going to do it via video chat. And so I thought that I would make a video about all the things that I've been realizing this week. I've talked to a lot of different friends that I hadn't seen in a while on this trip, and let them know about my diagnosis, and I've had some interesting insights into that whole process. So I already talked about how I found out about the tongue tie, what my symptoms were, and all that kind of stuff in my first video, Do I Have a Tongue Tie?, which I'll link. And I'm kind of going to go over some of that stuff again with a little bit of new insight. So I realized that so many people are just like, what? When you talk to them about tongue tie, like they've either barely heard about it before or they've never heard about it before. And when that's the case, the question is always like, well, what are the symptoms? Like what do you experience? And then when I tell them that it's like surgery to get it cut, there's like 12 weeks of myofunctional therapy exercises, it's really hard for somebody to wrap their brain around it. And I remember even just like 3 or 4 weeks ago when I was learning about all this stuff, it took me like hours of research online, looking around and poking around to find an actual description of like that basic info. You know, for me, I think my situation in particular is that I had a tongue guard when I was a kid. And somebody told me basically your tongue is in the wrong spot at some point when I was a kid, but they never told me about the tongue tie. And I have had all of these symptoms, again, which I go over in that first video, but I have had all these symptoms of like mumbling, mucus, sinus issues, allergies, neck and shoulder pain, jaw pain, trouble sleeping, mouth breathing, drooling on my pillow, history of orthodontic work, sometimes headaches and things. And then the psychological effects of like feeling like I am not heard when I speak and having kind of like developed social compensations for not necessarily being confident about my vocalizations and my speech. Although I didn't really realize any of that until a few weeks ago. And I think that I decided like that's how I am. And also before this, I was really thinking that, you know, I probably have ADHD. There's a history of ADHD in my family. I've lived with that with one of my parents, and I know the symptoms pretty well. And so I was thinking like, wow, I think I do have ADHD. And I talked to the first therapist that I did a consultation with, about there being a potential correlation between ADHD and tongue ties, especially in children. So releasing the tongue tie and doing myofunctional therapy could help people that have ADHD. And with one of my parents, I really see they also have sleep apnea and TMJ issues. And, you know, just seeing that person go through their lives with those issues and how debilitating they can be. You know, years and years of meds, years and years of using a sleep apnea machine. You know, that was like a revelation when sleep apnea got diagnosed and the CPAP machine started being used. Wearing mouth guards at night to prevent grinding and jaw pain and all those different things. You know, it's hard. It's like wonderful to have a diagnosis for something. And it's also hard when the diagnosis is like, and we don't actually know how to really solve this. And we can give you these things that will make it less of an issue in your life, but they're not getting at the root. And I think that's why I'm so excited about myofunctional therapy and cutting the tongue ties or releasing the tongue ties, is because what it seems to me is that it really it gets to the root of the issue. And the fact that you're not just cutting a tongue tie, but you're cutting a tongue tie and doing physical therapy for your tongue, it feels like it has the power when you go through the process with intention to actually get to the root of what's going on. So hopefully I'm going to see, you know, my neck pain be released. one of the things that I talked to a friend about this week was, you know, like, what if we could sing better? And I said, you know, I read on a Facebook group that somebody experienced instantly being able to sing in different octaves that they hadn't been able to sing before, or different, like, you know, alto, soprano, all the different things. And we were like, wait, what if we could just sing better after this? That would be so cool. So I don't know, there's like a little bit of like a unleashing of the human potential that I feel with doing this therapy that feels very different than going to the doctor and getting meds for ADHD or getting a CPAP machine because I have sleep apnea, which I haven't been diagnosed with sleep apnea, but I imagine that I'd be headed there. Yeah, I also have just been really paying attention to my breathing since doing all this, and I really see the way that I breathe up here and not in my belly. And even when I just put my tongue in the spot or the place behind your teeth where your tongue is supposed to be resting, and even though the rest of my tongue can't lift properly into the posture, like resting posture, back on my palate, it's just up in the spot, and then it's resting low, which is improper tongue posture. Even that still really helps me. It like triggers a breath in my belly, which is so weird. But it's really cool. Yeah, so those are a little bit of like what I've just been thinking about, especially talking to a bunch of people this week that I'm like explaining it over and over again. So like, what is this tongue tie? What are you doing? And seeing a lot of people being like, huh, yeah, that sounds like me. But I guess I just want to encourage anybody watching this, like, if you do feel like maybe it's something to look into it and find a Facebook group that you can like ask people questions in, and you're welcome to ask me questions, just to keep going and getting information and like not give up on your journey of maybe you could resolve things that you thought you couldn't resolve before. Another thing that I wanted to talk about, I have a friend who is very close to becoming a certified midwife in California. So she's been going through years and years and years of apprenticeships and trainings and all kinds of different things. And I've known them for many years, and they've, you know, worked in birth for many years. So they've seen tongue ties get cut for babies who are not breastfeeding or causing pain for the mother in breastfeeding. And that's pretty like normal these days, especially within the midwife community. And there's they work with a specific person in their area who does the cuts. And she told me, I said this thing about getting tongue tie, and she's like, oh yeah, da 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 da. There was a mother one time who, when we got her baby's tongue tie cut, her partner had the tongue tie like anterior, which is like to the tip of the tongue. It was tied. And basically they couldn't move their tongue past their lips. But they were like, I would guess like 30s or 40s, you know, they were having a baby, and they were like, well, it's not bothered me to this point in my life. Why would I get it reversed now? And my friend, that was like her thing. Like, well, why would you get it taken care of? Like, what's the big deal? If you have a tongue tie, you're fine. So I'm realizing how many people are in this mindset, and like how few medical professionals even know about this whole form of therapy and like movement of people getting adults to look at their tongue ties and having amazing results with resolving issues that people thought that they couldn't resolve. So it's like sad for me to see that like there was an adult with like a clear tongue tie that didn't see the benefit and probably still has that tongue tie. And I wonder, like, what could their life be if they had it done? Of course, we don't know. It could be that, like, they would have a bad experience with that and it didn't actually help them or whatever. But, yeah, the stories that I've read about people getting their tongue ties cut, it's pretty amazing what happens after. So I'm talking to my friend, and I told her, you know, what's been going on with me this year about I have a septum in my vagina that I've had since birth. And I got that revised. So I got the septum cut out, and I had surgery a few weeks ago. And I also had a heart murmur as a child when I was born, and I have the tongue tie. So those are all what's known as midline conditions or midline defects. My midline conditions, I never really thought much of them in terms of there being a biological basis for them. I always thought of them more in terms of like, I wonder what was happening in my mother's womb. And I kind of always figured that it was environmental in nature, that there, you know, we live in the industrial era, that there were probably like, you know, agricultural runoff, pesticides or things going on in the water that my mom was drinking, like not even necessarily when she was pregnant with me, but just like in her system and the whole 9 yards of like, we live in a toxic world. So we have toxic things happen sometimes. But my midwife friend said that there is a correlation between the MTHFR genetic variants and midline defects, which I didn't know. And my primary care provider, who got me diagnosed with mold illness earlier this year, highly suspects that I have the MTHFR genetic variants, and I have a blood test ordered right now to check to see if I actually have it. So it's not confirmed. I'm going to look into this MTHFR genetic variants and if it has anything to do with like being a precursor to people having tongue ties or midline conditions. Okay, so I'm home now and I did some research and I found out that there definitely is some basis for the MTHFR genetic variants affecting midline development, so creating midline conditions. And I found one website that talks about this specifically with tongue tie, heart conditions, and other midline defects. And so I have the B12 deficiency, as well as tongue tie, as well as I was born with a heart murmur, as well as I was born with a vaginal septum. So that's 4 different kind of markers that indicate that that could be a reason why I have tongue tie. I posted on my Facebook today about this and I saw somebody comment about low-calorie diets in the 80s and, you know, different diet eras contributing to the high level of tongue ties, which I hadn't seen anything about that. Definitely something to research more. I think people are really curious, like, why would somebody develop a tongue tie? Has this happened since forever? That was actually a conversation I had with a friend. Like, were they cutting tongue ties like prehistorically, or were people just like having mouth problems? Like, why do we have so many mouth problems? And I certainly don't have the answer to that, but I'm really interested in these explorations. That's it for week number 3. I will be back next week with video number 4. Hit like and subscribe and you'll hopefully get to see the next time I post. If you have any questions, let me know, and have a great week.